Welcome guys to another YouTube video. Today I'm talking about premature ejaculation, right? So this is one of the most sensitive topics as far as reproductive health is concerned. It affects many people. So I hope you will learn in this video. So if you have not subscribed, please do kindly like and share, and also let's interact in the comment section, right? Yes. So premature ejaculation, what is it? So basically it occurs in men when the semen leave the body sooner than expected, right? So the semen leaves the body sooner than expected during sexual intercourse, right? So maybe after 5 seconds of honest work, you ejaculate, right? Or even 10 seconds of honest work, or even 1 minute of honest work, you ejaculate, right? So it's a very, very sensitive topic. So it affects many people. Maybe you may have experienced it in one way or the other, or maybe your friend, right? So let's learn about it. So in this video, I'm going to talk about the causes. I'm going to talk about the classification, right? Yes. So basically, within 1 minute, within 1 to 3 minutes of sexual penetration, right, you ejaculate. But this may not be a cause of concern if it does not occur oftenly, right? It may only become a cause of concern if one, you always underline the term always. You always ejaculate within 1 to 3 minutes of sexual penetration. Always. Every time you have sexual intercourse, you always ejaculate within 1 to 3 minutes of sexual penetration. Or two, you are not able to delay ejaculation. When you are sexually stimulated, you cannot be able, you as an individual, you cannot be able to delay. Always, every time you're having a sexual intercourse, you cannot be able to delay the ejaculation, right? And the third criteria is when this act causes you distress. Maybe you are frustrated and you tend to avoid sexual intimacy, right? So one, we said that you always ejaculate within 1 to 3 minutes of sexual penetration, right? And again, you are not able to delay ejaculation once you are sexually aroused, right? And the third one is that this premature ejaculation causes you distress, maybe frustration, and sometimes you tend to avoid sexual intimacy because of premature ejaculation, right? So a research was once done, and it was found that many people say, not many people, 1 in 3 people said that they experienced premature ejaculation in one point of their life, right? So that's how serious it is, right? But it is not a cause of alarm if it does not occur oftenly, right? It only become a cause of alarm. It's always every time you are having sex, you ejaculate within 1 to 3 minutes, always. Or you cannot delay ejaculation once you are sexually aroused, or it causes you distress, frustration, and sometimes you tend to avoid sexual intimacy, right? So in today's world, it's very, very difficult for boy child, right? Because if this thing happens to you, in most cases, let me say the manager may decide to sign a new player to either to replace you permanently or on loan as soon as your injuries, and this may really affect you psychologically. I hope you understand what I'm saying, right? A manager may sign a new player, right? Or the manager may decide to go and tell the board or the whole board about the situation, and this may cause you a lot of psychological disturbance, right? I hope you understand. So it's one of the most sensitive areas, right? So the semen leaves your body earlier than wanted during sexual intercourse. So basically, premature ejaculation is not all about sexual intercourse. It occurs in all sexual situations, right? It can even occur when you are masturbating. After maybe 2 seconds of honest work in masturbation, you ejaculate. That is premature ejaculation, right? It's not all about that it can only happen when you are doing sexual intercourse, right? So it can occur also in masturbation. After maybe 5 seconds of honest work, you ejaculate. That is premature ejaculation, right? So many people conclude that they have premature ejaculation. However, most of their symptoms does not meet the criteria for diagnosis so far of premature ejaculation. So if you have this kind of situation, just visit your healthcare provider, right? Go and open to him or to her about the situation, right? Because opening up can be enough, because most of them are psychological. Most of the causes are psychological. So if you open up to your healthcare provider, or it becomes easier, right? Because one, let me surprise you. So the average duration from sexual, from the beginning of sexual intercourse to ejaculation is 5 minutes. Do you get that? The average duration from the beginning of sexual intercourse, that is sexual penetration, to ejaculation is 5 minutes. So maybe you always have maybe 2 minutes of honest work, or maybe you are 1 minute of honest work. Don't kill yourself, right? Don't kill yourself, right? Because the average duration from the beginning of sexual intercourse, that is sexual penetration, to ejaculation is 5 minutes, right? But again, I'm not advocating for 2 minutes of honest work, right? That's how it is, right? But many people can maybe attain maybe 2 hours, maybe 1 hour, maybe 30 minutes. So it depends on you and your partner. But the average duration from the initiation of sexual intercourse, that is from the penetration to ejaculation, is 5 minutes. So again, don't kill yourself. It's normal to have premature ejaculation, but if you always have it within 1 to 3 minutes of sexual initiation, you have premature ejaculation. You are unable to delay ejaculation once you are sexually stimulated. Every time you are having sex, you have it. And again, if this thing causes you distress, it causes you frustration, it causes you maybe to avoid sexual intimacy, you have it, right? So let's what causes it? What causes premature ejaculation, right? Uh, the exact cause of premature ejaculation is not yet known. However, it was initially believed that it is mainly caused by psychological causes. That premature ejaculation is in the mind, right? But this is not the case. So premature ejaculation involves a complex interaction of both psychological causes and biological factors. It involves complex interaction of both psychological factors and biological factors, right? So what are the psychological causes of premature ejaculation? So one is early sexual experiences, right? Another one is sexual abuse. You may have been raped, so and this has caused you to have something called post-traumatic distress. This may cause premature ejaculation. Another one, you have low self-esteem or poor body image. So low self-esteem can cause you to have premature ejaculation. Another cause is depression. Ideally, you cannot function well. Your body system cannot function well when you are depressed, right? You cannot function well when you are depressed. So depression is one of the psychological causes of premature ejaculation. So another cause, the fifth cause, is worrying about premature ejaculation. What happens? Like maybe your friend told you that he had been experiencing the same. He had been having premature ejaculation. Now you get this new player. You have signed a new player, and then you start worrying, will I have it? What will happen, right? That can cause you to have premature ejaculation, right? Yes. So another cause is performance anxiety. Performance anxiety. This is very common, very common, especially when you are starting a new relationship, or maybe you are new to each other, you are new to an environment. You are always wondering, will I really perform? And how will the player maybe take the outcome, right? So will I really perform? Performance anxiety. It is one of the main psychological causes of premature ejaculation. Another cause is relationship problems. When you don't have peace with your partner, when you don't have peace with maybe you are a couple, and you don't have peace, again you cannot function well, and this is one of the causes of premature ejaculation, right? So I've talked about, so far I've talked about depression, I've talked about low self-esteem, I've talked about early sexual experience, I've talked about sexual abuse, maybe rape. I've talked about worrying about premature ejaculation. I've talked about performance anxiety, very important, a very important cause of premature ejaculation. I've also talked about relationship problems, and again, being anxious about getting and keeping an erection during sexual intercourse, right? You are anxious. Will I really attain? Will I really get erected? Right? Will I really erect? Right? And will I really maintain my erection towards the end of sexual activity? This causes premature ejaculation, right? So those are the psychological causes. What are the biological causes? So biological causes, we have four main biological causes of premature ejaculation. One is irregular hormone levels. So, for example, testosterone. Testosterone plays a very major important role as far as human sexual response cycle is concerned. So, again, if it is in excess, the levels are in excess, it increases sexual excitement, and this may lead to high possibility of having premature ejaculation. Another biological cause of premature ejaculation is brain chemicals, regular levels of brain chemicals, or what we call neurotransmitters. So, for example, dopamine. So, dopamine is important as far as human sexual response cycle is concerned. However, if it is in excess of the normal levels, it increases sexual excitement to a higher level, which may increase the risk of having premature ejaculation. If you are extremely sexually excited, you risk having premature ejaculation. On the other hand, serotonin, it causes an inhibitory effect on ejaculation. So high level of serotonin decreases your risk of ejaculation. However, high levels of dopamine increases your risk of ejaculation. So serotonin decreases the risk of ejaculation, but dopamine increased levels increases your risk of having premature ejaculation. Another cause is inflammation or infection of either urethra or the prostate, something we call prostatitis and urethritis. So they can cause you to have premature ejaculation, right? So the last biological cause is genetics or inherited traits. You may have inherited traits of premature ejaculation from your grandfather, from maybe your grandparents. It is a possibility. However, the studies have not proven it so well, right? But it may be a cause. So that marks the end of my video for today. The next episode, I'm going to do something on management of premature ejaculation, right? So I hope you enjoyed the video. Thank you for paying attention. I hope you learned something. So please remember to subscribe, share, and like. Thank you.